Idaho Matters podcast is brought to you by St. Luke's On-Demand Virtual Care, which allows patients to see a provider from their home using a computer or smartphone with on-demand care for common ailments, such as a cough, sore throat, or a sinus issue. More information at stlukesonline.org.
In collaboration with Boise State Public Radio, the Community Library presents a new podcast, Sheep Stories. I'm host Vance Cunningham. Join me as we listen through the archives of the Trailing of the Sheep Festival to learn about the Scottish, Basque, and Peruvian immigrants foundational to the sheep herding industry over the past century. Hear their stories of traveling to Idaho and learning the language of the sheep. Find Sheep Stories wherever you get your podcasts and at boisestatepublicradio.org.
From the studios of Boise State Public Radio News, I'm Gemma Gaudette. This is Idaho Matters. A new announcement by the President and Health and Human Services Secretary Robert F. Kennedy Jr. this week is telling pregnant women to avoid taking acetaminophen, better known as Tylenol. During a televised news conference yesterday, they stated there was a link between Tylenol use in pregnancy and autism. Now, that claim it quickly gained national attention, and health experts are saying the evidence simply does not support this theory. So, what does the science say? Dr. David Pate, former CEO of St. Luke's Health System and the co-author of the book Preparing for the Next Global Outbreak, is here to break fact down from fiction. Dr. Pate, good to have you with us.
Thank you, Gemma.
And folks, if you have a public health question, send us an email, idahomatters@boisestate.edu. Dr. Pate, I am curious to know, when you first heard the president's statement linking Tylenol use in pregnancy to autism, what was your immediate reaction as a medical professional?
First of all, shock and awe. And second, I flashed back to the take bleach or insert a light into your body for COVID moment. Very reminiscent of that. I just was absolutely astounded by the announcement by the president.
Let's talk about the best available research. What does it actually show in regards to Tylenol or acetaminophen and using it during pregnancy and any connection to autism?
So why this has become an issue is that, first of all, we're very careful about all medication use in pregnant women. We're concerned about the potential effects on the developing fetus, the safety for the mother. And so there are not many medications that are deemed safe to be used during pregnancy. And so this needs to be guided by the healthcare provider managing the pregnancy. Now, given that there's not many other medications to be taken, almost anything that happens during a pregnancy, if you want to try to correlate it, well, with what medications was the mother taking, good chance that they were taking something, it was acetaminophen. And in fact, early studies just showed an association. In other words, it seemed to be that there might be a slight increase in autism when mothers took acetaminophen. The problem with that is that as scientists, we always have to make sure we don't jump to conclusions and say, aha, then it must be the acetaminophen. The next question to ask is, why did the mother take the acetaminophen or Tylenol? And what you find out is that the most common reasons for pregnant women to take Tylenol are infection, fever, migraine, and autoimmune diseases. And most, if not all of those underlying conditions have been associated to some degree with increased risks for various neurodevelopmental problems. So that right there should tell you it may not be the Tylenol. It may be just that they're taking Tylenol and it's really this other problem. So how do you answer the question? Well, what you do is you take siblings. And the reason you do that is there is overwhelming evidence that at least 80% of the risk for developing autism is related to genetic factors. That's not the whole answer, and it's complicated, but that is a big factor. So what do we find? Well, what we find is if if you look at families, if you have a half sibling, in other words, you only share one parent, the risk that the another sibling in the family will develop autism is threefold increased. If it is a full sibling, you have both the same parents, that risk is increased tenfold. And if you're identical twins, that risk is increased by 65 to 90%. So
Mm,
it clearly has a genetic association. So what this study did is it looked at the population of children in Sweden, almost 2.5 million children, and they matched siblings. And they looked for pregnancies in which the mother had a child and did not take acetaminophen, and pregnancies where the mother had a child and did take acetaminophen. And now we could directly compare that same mother and now two siblings. And what we found is that, and these children were followed up anywhere from 2 to 26 years. And what they found is there in the mother's in the sibling that was when the mother took acetaminophen, there was no increase in ADHD, no increased risk for intellectual disability, and no increased risk for autism. So it is really, there is no evidence that Tylenol use will cause autism in children. And later on, President Trump essentially admitted as much on further questioning.
mhm. So, Dr. Payne, I want to talk a little bit more about autism spectrum disorder itself, because one of the claims that they made during this news conference is that we have seen this huge spike in cases in autism in the United States. Therefore, this is an epidemic. We need to figure out why this is happening. I want to go back to the diagnostic criteria being changed back in 2013 with the DSM 5. Can you talk about what adjustments were made and how did those changes affect the number of people who are now considered on the autism spectrum? For example, Asperger's syndrome until 2013 was not put under the umbrella of autism spectrum disorder. It is now.
Precisely. So, this again, just like I said earlier, the way that a scientist would look at that, uh, those reports of a slight increase with use of acetaminophen, we got to ask more questions and see if there's something behind that. The same thing here. If you see a marked increase in a disease or disorder, you need to look at the time period over which you saw that increase and determine, well, what all has changed. And to your point, what has changed is that when I was in medical training, what we understood as being autism was a small fraction of what we understand autism spectrum disorder to be today. In fact, we didn't even have that phrase when I was in training. And you are absolutely correct. There were children with quote unquote autism were considered a separate group than children with many other related type disorders like Asperger's until the criteria changed and that we realized that autism is not a single unifying disorder. It is part of a spectrum of a disorder. And so not only did we expand the definition, which now meant there were going to be more cases included in this category, but we have gotten much better at screening children. And if you do
Mhm.
more screening, you're going to find more cases. And not only that, we have gotten better at evaluating children earlier in life to detect it. And so all of these reasons have contributed to a tremendous increase in the number of children being diagnosed with this disorder. That does not mean that any of these conditions are necessarily increasing in addition to that.
And I want to point something out for people to maybe have a better understanding of this. When mammograms were introduced in the United States, I believe back in the mid 80s, the detection for early stage breast cancer nearly doubled in the United States, with a substantial increase of about 4% per year, um, as more and more mammograms were being done. I point this out, Dr. Pate, just for the pure fact that, as you mentioned, when we screen and we screen more often, we of course will pick up more cases. It wasn't that all of a sudden more women got breast cancer. It is that we were screening more women and we were screening them earlier, therefore, better outcomes. And I would think better outcomes if we can catch a child on the autism spectrum younger.
Well, so you have got a great point about the mammography, and the same thing can go for so many other diseases. We diagnose more cases of prostate cancer much earlier when, if previously you had to rely on a digital rectal exam and feeling the prostate, to when we now could do PSA tests and identify it much earlier in the blood. So yes, that's exactly right. When we do more screening and we have more sensitive screening, you're going to find more cases. Um, and the importance of doing this is we are not going to fully understand what causes these disorders until we can identify the universe of these disorders and look at commonalities and look at studies to identify what is going wrong. So this increased identification, first of all, should give a number of parents some comfort who have seen things in their children but not had a good answer, so we can give them an answer. But it also offers the promise that we are getting better, and we're going to get better at understanding these diseases. The amount of knowledge we have gained about neurodevelopmental disorders in both or neurodegenerative disorders in both children and adults is just skyrocketing, and has led to all kinds of new findings, including, like we talked about, the association of Epstein-Barr virus with multiple sclerosis. We're now
Mhm.
identifying other viruses that are likely contributory, and we're going to get a much better understanding. But we're not there. We don't completely understand this disease yet. We don't have effective treatments for it, but we have promise.
And I think it's important to point out that it felt like in that news conference yesterday that autism is something that is awful and horrible. And I do understand that there are families who have loved ones with very severe cases of autism, and I do not want to disregard that. With that said, I know many people who have children with autism, dear friends of mine. Their children are highly functioning, they are living their best lives. And I bring this up, Dr. Pate, because when statements like this that we heard yesterday, it seems to me that it degrades the public trust in medicine. So how do you get folks to trust, the medical community, right? And also this idea that autism in many cases is not this death sentence.
Well, you're exactly right. We have to remember that the reason we call it autism spectrum is that there is this wide variation. And frankly, there are many more autistic people that I would enjoy spending my time with than some of the quote unquote normal people out there. So, autism is different in every child. And
Yeah.
look, I don't want any child to have any disorder, but we have to understand children are resilient. Children are also able to overcome obstacles and hurdles in their life much better than many adults. And we do see autistic children accomplishing amazing things. And so there is hope. But we also have to Let these parents know that we're going to pursue the science because we should not be creating false hope. And we're going to pursue the science and we're going to keep looking for cures. What we could benefit from is certain government officials stop offering medical opinions, which they are distinctly unqualified to do so, and start offering more funding for high quality
Mm.
research in these areas so that we can get to answers.
Bottom line, Dr. Pate, what should pregnant women do now, right? When it comes to the use of acetaminophen. And I ask this question because having been pregnant, having had two children, no, I am not a doctor. I am not an expert in that field. I think I'm fairly a bit of an expert when it comes to having been pregnant and birthing two children and having the stress and the trauma that is already associated with every risk out there when you are pregnant. And the one goal that you have as a pregnant woman is to have a healthy baby. And there is already so much information and so many things you're not supposed to do that are going to harm you or harm the fetus. I could go on and on about this. I- And and this is just one more thing that it feels like it's guilting women and putting the blame back on them if, God forbid, their child is born with some type of disorder.
Amen, Gemma. And I do think that's one of the consequences of this. And as I listened to the president's comments, let me tell you, people that knew my wife, when he said, "Don't take Tylenol. There's no downside. Don't take it. You'll be uncomfortable. It won't be as easy, maybe, but don't take it." I thought, if I was going to say that to my wife when she was pregnant or in labor, I would have backed up so that she couldn't slap me, and I would have made sure there was nothing in her hands she would have thrown to me. We don't need men to tell women that they just need to suck it up. And let me tell you, there's no man that I know that could tolerate pregnancy the way women do. I have endless admiration. Here's the thing. Number one, make sure you talk to your physician or who's managing your pregnancy. Talk to them. They know you, they know your history, they know your circumstances. They can discuss this with you. So talk to them. They will give you good advice. The other thing is, if you are looking for some authoritative advice, you can look to, for example, the American College of Obstetricians and Gynecology, which is the professional association for OB-GYNs. You can look at their statements. They are very clear. You can talk to if you already have a child, talk to that child's pediatrician and see what they have to say, because pediatricians know that this is a safe thing to do. And you can look at the American Academy of Pediatrics website if you want, again, more authoritative advice. And of course, you and I will continue to try to debunk some of these things. And of course, we want to try to be a good source of information for women too. The key thing is there are some very good reasons to take acetaminophen or Tylenol during a pregnancy. As Dr. Oz says, women shouldn't be taking it willy nilly, but I don't know any woman that does. It's
Mhm.
when it's needed, it is a godsend. And just talk to your OB-GYN or other provider, and you'll get good advice.
The CDC's Advisory Committee on Immunization Practices met last week to review and update our nation's vaccine recommendations. The panel focused on three vaccines: COVID-19, hepatitis B, and MMRV. So, Dr. Pate, let's break this down vaccine by vaccine. And I do want to know, we have to go through this fairly quickly to stay on time today, but you have some very great blog posts on your blog, Dr. Pate's blog, that really goes into this in depth. So, I want to start with the MMRV vaccine. Can you tell us what this is? Because my kids got the MMR vaccine and then they got the chickenpox vaccine later, but that could be due to how old they are.
Well, and that is the most common situation. So, children need 2 doses of MMR, which is measles, mumps, and rubella, which is the German measles, and they need 2 doses of varicella. The issue, and so what we typically do is we give a dose at around 12 to 15 months of age, and then we give the second dose between 4 and 6 years. The question is it better to give those 4 vaccines as 2 shots, which is how you described what your kids got, and they get one in one arm, one in the other, or one in one leg, one in the other? Uh, is it better to do that, which reduces the risk of them having a fever after, slightly reduces that risk after the vaccines?
Hmm.
Or is it better to give them as all 4 grouped together because it means 1 shot instead of 2? And the reason for the difference between the recommendation for the younger age group, that is, give the 2 separate shots, but you can take the combined shot if the parent wants, is because when you reduce the amount of fever after it, you reduce an uncommon, but we do see it all the time, because it's only like about 2 to 4% of kids where they'll get what's called a febrile seizure. Very, very scary
Hmm.
looking to the parents, but really of no medical harm. So most parents opt to do it the way you did, get them separate. Basically, ACIP, it depends on if the acting director approves it, but they took that choice away. Now you cannot get the combined vaccine under age 4.
Okay. The other one was hepatitis B vaccine. This is something that babies get shortly after birth. Um, again, Dr. Pate, um, what is the hepatitis B vaccine and why is it given shortly after birth?
So, hepatitis B is a virus that the earlier in life you acquire it, the more likely you're going to develop chronic liver disease. And what we mean is cirrhosis, liver cancer, even death, or the need for a liver transplant. And what happens is that if most people that are infected, well, half of people that are infected with hepatitis B around the world, including the US, don't know that they have it. And so you can't go based on symptoms. And the problem is, if a mother has hepatitis B and it's not known, they could transmit it to their newborn child in up to 85% of cases. Then, if the baby does get infected that early, they have up to about a 90% chance that they're going to develop these chronic problems. Totally preventable, well, almost totally preventable by giving the vaccine around birth. And so ACIP decided, for some reason that never got clarified, as to why they're going to revisit this, because this has been the practice for quite some time. And this is the direction all the countries in the world are moving, is to give this early dose. And they voted that if the mother did not test positive for hepatitis, then delay that first dose from birth to 1 month. But they gave no reason why is it better to get it at 1 month. And in fact, all
Mhm.
the experts were chiming in that we're going to see more cases of it because you don't just get it from the mother. We also know you can get it from household contacts. So that was disappointing, but fortunately, that issue also got tabled. There was so much consternation.
Okay, I have about 2 minutes left with you, Dr. Pate. So we've got to get to the COVID-19 vaccine. What was decided about this? Because there has been all kinds of confusion around it this fall.
And the committee created tremendous confusion. I have a terrible headache from this. Basically, what the committee recommended is, and frankly, this is a better recommendation than what the secretary had announced months ago on social media. They decided that adults 65 and older, vaccination could be based on individual based decision making, which means you just discuss the pros and cons with your doctor or whoever is, maybe a pharmacist, whoever's giving you the vaccine, and you decide. And also said, to my surprise, 6 months age to 64 years, the same thing. Basically, just talk to your provider. So, this recommendation removes the requirement that was previously in place that you had to have, if you were under 65, you had to have a underlying medical condition. Now, um, we cannot take this to the bank yet because this will
Hmm.
only become the decision if the acting director of the CDC approves this. And I am not confident about that. It would be good. The big question is generally when the committee recommends that it's based on this individual decision making, that means it's not a standard recommendation and it may not be covered by a number of insurance programs. The chair said it would be covered. That is a little bit at conflict of what I understand. However, representatives from CMS and from the Vaccines for Children's program were there, and they didn't speak up to correct them. So I'm hopeful, but we need to see what happens in the next upcoming days.
All right. Well, Dr. Pate, so appreciate that. I know we had to get through that quickly because of time restraints today, but do go to Dr. Pate's blog if you want a really detailed information about what happened in those in that meeting last week. This is the Idaho Matters podcast. I'm Gemma Gaudette.